Good evening, dear viewers, and welcome once again to your program Health Link, brought to you here in the studios of QTV on Kairaba Avenue every Monday evening by myself, Dr. Abubakar Jah, normally also Loli Kamara, and recently Lamin Dabo for the translations. But today I'm alone here. Mainly because my guests today speak the local languages very well, and because we have 3 guests, we thought that we can do this program on our own. So for the fans of Loli and for Lamin, we will have to do without them today. On this day, we were hoping to talk about cancer. Because it is October, which is referred to as Pink October for breast cancer. But because of a request from the ministry, we have decided to change the topic to something even more important, which we are suffering from now, our children are suffering from, and there has been a surge of children dying because of that. And I think it is very important, and I thank the ministry for choosing this program to be able to convey to our viewers about this important thing that is happening in the country. And obviously lots of things are going on in the background that the public doesn't know, so they will be very happy to hear from them. So today I have very, very important guests here, and maybe I'll introduce them before we go into the program. On my extreme right, we have Dr. Abubakar Jany, who is working at the Edward Francis Small Teaching Hospital and is now, in fact, the Deputy CMD for the Edward Francis Small Teaching Hospital, and is directly dealing with these patients, and also was very much involved in the COVID response. And I'm very happy to have Dr. Abubakar Jany here with us today in the program. Dr. Jany, you're welcome.
Thank you.
And next to Dr. Jany, I have a very long-term colleague of mine who we were actually in pre-med school together when we were starting our medical career, and he went into pharmacy and I went into medicine, and it is no other than Mr. Esa Marena, who is a pharmacist and is now with the medical control agency or authority, and he will tell us more about that. Dr. Marena, we are very happy to have you here. Mr. Marena, we are very happy to have you here.
Thank you for having me.
And then we have Dr. Mane on my left side. We have not worked directly together before, but he is an epidemiologist, which is very important, and he also deals with such things. Dr. Mane, you are welcome on the program.
Thank you, my pleasure.
So we will be having these very knowledgeable people on this panel today to talk about the recent problem that we are dealing with and are still dealing with, and we need to work together to make sure that it is under control. mbokk yi ñu ngi leen a nuyuwaati fii nii ci seen programme yi Health Link bi nga xam ne man Dr. Abubakar Jah ak Loli Kamara ak Lamin Dabo ñoo leen ko dee indil fii nii lundi ci ngoon bu nekk. Tey nag dañ bëggoon a waxtaanee mbiri cancer parce que weeri cancer la cancer bu nga xam ne moo dee di dal jigéen ñi ci ween bi, waaye ministre bi ñoo soxloona am ay yëgal yoo xam ne dinañ ko yëgal askan bi, moo tax ñu waxoon nañ ne bëggoon nañ a toog ak ñun ñu indi fi ay borom xam-xam yoo xam ne si lii la ñoo liggéey. ñun ñëpp dégg nañ ci news bi, ci social media bi, ne am na feebar boo xam ne mu ngi dem ci dëkk bi léegi boo xam ne xale yu ndaw yi ñu ngi see deeyee ñu bëri. mu am wax yu bëri yoo xam ne ñu ngi si, so ñu indil ñu ñi nga xam ne seen xam-xam màcc na ci lii pour ñu mun ñoo wax mbir mi naka la demee. ñu am Dr. Abubakar Jany, Mr. Esa Marena and Dr. Mane. ñoom ñëpp nag ministre bi moo leen yónnee fii nii nga xam ne dinañ mun a waxtaan ak askan bi, soo ñu ngi leen a dalal fii nii. nu ñoo def rek mooy dinañ dugga ci topic bi, ñu leeralal ñu mbir yi. Dr. Jany moom dégg na Mandinka bu baax, dégg na olof bu baax, baax so lépp luñ ko laajte rek dina ko tontu ci anglais dinañ ko faram-fàcce ci wolof dina ko wax tamit ci mandinka docteur Mr Marena ak docteur Mané ñoom dinañ wax lu ñoo wax ci anglais ak ci mandinka den man dinaa ko jéem a faram-fàcce ci lu ma ko munee yëpp ci olof ñu mun a continuer programme bi nga xam ne dinañ waxtaanee lu bëri parce que time bi bëriwut pour waxtaan bi nii so ni ñoo commencé rek dinañ wax docteur Diagne ñu laaj docteur Diagne feebar bi ci anglais ñu ngi ko ooyee AKI. I think we'll start in English. I'll ask you the question in English, Dr. Diagne, and then you can respond in English and make the translations as much as you can in terms and summarizing it because the time is not much. But the first thing that we want to know is what is AKI? We're referring to AKI, which stands for acute kidney injury, but what does it mean? And when it happens, this disease that is happening now, when it happens, how does it affect these children?
So thank you very much, and thank you, viewers. It's a pleasure to be here, and this is a very important thing for us, for the country. And after all the stress we are dealing with, being here is very important to us. AKI is, just as the name goes, acute kidney injury, meaning something acutely happening to the kidney within a short period of time, and the kidney is not functioning normal. So that is what it meant by an acute kidney injury. A lot of things cause it, but for this particular situation or this particular thing that happened, it's very unprecedented. For my practice as a resident, up to the time I graduated, I spent 5 years to study only kidney, and all my career I have never seen more than at one time I'm called to see 2 children having an AKI. So when this situation occurred, then I had phone calls that 3 kids were in one ambulance, all of them have AKI. Then I was shocked. And because of it's unusual for kids to have AKI, so once we were referring them, they didn't know where to send them to. So apparently they sent them to Nebat, where emergency is. And when they got there, they told them, no, this is not the place. This is go to pediatrics. So then they took the children to pediatrics. So that alone was striking. And when they mentioned to me how the kidney function was, first thing that came to my mind was maybe it's laboratory error. Was creating 1,500 in a 2-year or 1 year, 2-year-old kid. It's unprecedented. I've never seen it before, because creatinine comes from muscle. So if you say somebody's creatinine is that high, then that means you're looking at some huge man standing in front of you and his kidney not working for almost, say for days, then the creatinine has gone that far. But for a child that small, then something serious was going on. Then I started questioning what was going on. I said first, let's send the sample again and let's check. We checked, it was still the same. And I said, okay, the kids are not making urine. It's not about where AKI, you see, they're oliguric. They're making some urine. You can find some small streak of urine in their urine bag. These kids, you don't see any urine. So I got worried. And I started calling. And I started calling everybody that I knew. I called from down to my professors who taught me medicine, nephrology. I started calling them, asking them questions. I called Professor Nyan in Dakar to ask him questions about what do you think could be the answer. So he told me, well, you could look for anything. This could be anything, but things you should look out for are toxins. Things you look out for are infections. But infection usually is so not typical for infections. So we started asking questions. But AKI in real sense is not unusual, but it's not usual for kids. And of this kind, like an epidemic, I've never seen, and not many people in the world have seen them before. It was only seen in Asia and also sometime in Nigeria, but it's not common for that to happen. So, comme normal like ne lan moy AKI. So AKI moy ne kidney bañ rek tok rek bañ nekkuñ di dox nu wara doxé. Normally lu wundé woné moy seben du mëna ñëw nu wara ñëwé. Ak yeneen saa dafa woné yeneen manal nga moy yeneen yi da nga gis nit ki tànkaam yi néewi o kanam yi néewi yooyu kidney mandarga kidney problème la wante AKI si boppam normally noo ko dee amee comme ni yaa ngi wëccu because yaa ngi wëccu sa kidney nekkul di dox or biir bi daw nekk because of that sa kidney di dox or nga am infection kidney nekkul di dox so yooyu daf dee am but bariwut si xale yi balaa ngaa gis benn xale am na kidney problème man suma jànga bu maa jànga yëpp waxtuma 5 years ma defoon si Ghana di jàng musuma gis ñaari xale am kidney problème benn bés ñu maa oo on bés ma gisee ne biñ ma ooyee ne ñetti xale lañ def si ambulance ñu ngi leen indi si lopitaan ñoom ñëpp they are from the same family and ñu ngi leen indi si lopitaan bi they have kidney problem. I was really worried and luñ dee managa ni xale yi am is very atypical nuroowut nu mu dee wanee normally so loolu moo tax ñu gan si taxaw commencé laajte questions yu am solo pour xam lu nekk problème so comme ye ñini karo ko ñame ko munemo AKI wolon ko kilo e bandron wata kilo ngay lo fa ya ama ay balanka tama ñita tamala ñame amin ko sa sifa siat sa je comme min ka fono ko kono la ka bay o man domoro ka ñanta kala ñami o dobi ye fan hani yele solo na tambita wata dola sila staken dol min jalam to ka ken ka kolebulu o sa kena bar pour dindi mo ya soto kandi dindi wule ala kidney balang ko kilo balang o nyaawa o manki ku timi yalon kon dalta kaaj na karam wato kono fo mbeddo ko la wata min nene ma nje lumine en kuma dia fanyi ko dindi fula bebi je min la kidney problem soto o man taria ko dindi ilo sa sifa soto man taria ba biren lumina ngaaje en kuma ndi ko dindi saw bebi je mi nyim problem soto nya killing woyen jikilate baak utmo no wulta ka ko kabla ko nyinom so sa nyim aman dali aman taria so ne ko je min man dali kala drong isi lo no ya long fay lod la ka.
Thank you very much, Dr. Janya. I think it is very clear, and just so that we can make it very clear to our listeners and our viewers. So what you are telling me is that apart from the other symptoms that these children come in with, one of the most pertinent ones is the fact that the children are not making urine at all.
At all.
Okay, and in Wolof also maybe they should maybe we should just stress
so,
that.
Xale lu ci gën a bari mooy dañoo ñëw duñ mën a saweraat.
so toog nañ ay maybe fan ba jeex fan wala ay fan
ay semaine.
waaw seben génnut.
waaw
ok in Mandinka.
so mi ye ñi ko ñi jakala waro dinul ñi jamaña ni nata e ka jala muto fe buka fenk fe mbokana.
okay
e ka sile fo ay tili jama
Okay. So thank you very much, Dr. Janya. I think we'll just take it further with Dr. Mane. Mr. Mane, yes. So Dr. Janya has mentioned that he was surprised when he saw these numbers, and you know, I've been in this business for more than 20 years now, and I have never seen something like this myself. So it's really very rare. You know, you are an epidemiologist. I think for our viewers, we want to define what an epidemiologist is, what is the scope of your work, and then you can tell us also from your experience, you know, what are the numbers associated? How often do we see kidney disease in the Gambia? This current epidemic that we have, what are the numbers? How many children have died from this? How many children did we have that had this problem, and so forth? Just the epidemiological bit of things.
Thank you, Dr. Ja. Actually, epidemiology deals with determinants of disease, causes, and factors. And as far as we are concerned in the Gambia, this is the first of its kind for us to have a kidney problem to this level. And so coming back to who are affected and where they're coming from, actually we have kids from 5 months to 84 months, and then most of them are below 2 years. And we have cases in mostly these 3 regions, because for health we have divided the country into 7 regions. And that is Western 1, Western 2, and URR. This is where we have most of the cases. But of course, we have cases from the 6 regions, except North Bank East, where we don't have cases. So most of these cases are coming from these regions, and then majority of the kids that are affected are male.
Male children.
Yeah, male children, and yes. So far.
This is the situation. And if you can say that in Mandinka, then I can try to translate it in Wolof.
Thank you. nka min foto wala min te ko ntolla do ko nka muneke wala nyinte ko ka jube kurango ni munaka kurango sabu aka jumanyo le muta munatna ke muta alun kalon fanan mun kurang ke sifalo no bata je fanan nyin kurango ni be min kono tenting nga jelo ko jama ay mulmi muta folo jamal bota western wanle ko min tolla jata kinda bunda nga banko tala into bunda worowlalla ko min kumandam banko par dolbi je kumandam banko dolbi je ngeti la tin signafula so kesi sol jama bota ko mi kombuto ba banko la kanjang brika ma fango anin UR bar onya nga dol soto la min yalon ko ibota man sa kon ko banko kan bansam banko kan bar manke soto min bota nin kumu farafanya mafon bar jama fanan aka dino le muta mun yalon ko siobe dasarin sanji fulala ando kanan aka kambanno le muta bake dina sumtu ndingolti comme jok ca jani ya fu nyame ni ajube aye tamanser mi yitandi comme ni tata lopetano re kamin fo lente ko aka folo fono la ina fenkola no balakando ye fono soto anin kono bayo anin domo ndimbije toto a womu kulleti tamanser mi yalan ko pesenol ko le fo ni tata lopetano to.
Thank you very much Mr Mane mbokk yi Mr Mane moo doon wax ñoon moom liggéeyam ñu ngi ko épidémiologie ci loolu la moo liggéey mooy wax nañu ne liggéey bi nag moom lu mu dee di seet mooy feebar la na dee waral feebar ñan la feebar bi di dal ci yan gox la feebar bi dee di génnee ak façon yooyu noonu so ma laaj ko nag feebar mi nga xam ne moo fi am léegi nii AKI ci ñan la dee di dal wax nañu ne mu ngi dal xale yoo xam ne ñu ngi jógee juróomi weer ba juróom-ñett fukki weer ak ñeneent loolu nag mooy ne mu ngi dal xale yoo xam ne diggante genn wàlli at la ba dem ba boori ñeneenti at waaye mu ne lu ci ëpp yëpp ñaari at ak lu ko yées la dee nekk xale boo xam ne amagut ñaari at ñu ëpp ci xale yëpp loolu la wan nañu tamit ne si dëkk bi fii ñu ngi def gox juróom-ñaari gox lañ am si dëkk gi ci mbiri wér-gu-yaram mu ne nag juróom-benn yëpp gis nañ ci feebar bii nii waaye yu ci ëpp yëpp mu ne mu ngi nekk Western 1 Western 2 mooy Brikama ak ba URR ñoom tam am nañ ci lu bëri ci yoo xam ne mu ngi dal ñii nii waaye daal mu ne ñu ci ëpp yëpp ñaari at ak lu ko yées la wan nañu tamit ne digal na lu docteur Diagne wax léegi nii ne ñu ci ëpp su dut ne ñu ci ëpp yëpp luñ dee wax mooy ne xale bi duy seben loolu mooy li nga xam ne xale yëpp daanaka loolu lañ am waaye si dut loolu am na si ñoo xam ne dañ doon wëccu am nañu si ñoo xam ne am nañ yaram bu tànga ak yeneen mandarga yoo xam ne ànd nañ ak loolu noonu before I leave you just want us to tell our viewers at the moment now, I know that there are lots of things that are suspicious, yes, that we have suspected, so we're going to go into them with the clinicians and the pharmacists. Exactly. But I just want us to clear this first. Have we determined now what exactly is the cause? Do we know yet?
Actually, we don't know yet, but we are having clues that is enabling us to take some measures that will kind of reduce the cases that we have.
Okay.
Actually,
yes,
but obviously we have some suspicion, and then my colleagues, pharmacists, will also expand on those things.
Okay.
Yes.
So just like Dr. Diagne also has mentioned, there are several things that can cause acute kidney injury, including infection, including toxins, poisonous material that you have taken, and I think we're looking at all those things at the moment. But I think one of the areas now that we're looking at, and there's some action going on, Mr. Marena, is that there are some medications that children take that may be implicated in this, that we are studying. Can you tell us more about the role of, I'm going to invite the MCA in this program. I have actually been trying to invite the MCA because, you know, we have to talk about the MCA. It's a very important arm of the health in this country, and really the people have to know how much they are doing to keep them safe in this country, which is very important. But leaving that all apart now, what are the medications that are implicated, and what is your agency or your authority doing to try to take steps in that?
Yeah, thank you so much, Dr. Yeah, and thank you, our viewers. Pertaining to the sickness at the moment we are discussing acute kidney injury, there are certain medications which at the moment have been suspected to be possibly also involved. Either there could be a cause or they could also be aggravating the situation, because most of the time these children do come with symptoms, as said by the Mr. Mane. Most of them come with high fever, vomiting, and some also come with diarrhea, some also with cough. So it's natural that the parents or the whosoever is seeing these children will be given medications. And one of them would be paracetamol for the fever, the other one would be promethazine for the vomiting, and the cough syrup for the cough. So though there are other medications also they have used, multivitamins and amoxicillin syrups and so forth. But when the situation happened, MCA, in collaboration with partners, what we did, we took samples of the medications that were collected from the patients themselves, the medications that they took. So we took portions of those medications, sent them to Ghana. There is a WHO accredited lab in Ghana called USP Ghana. These products were sent there for testing, so they provided us with the preliminary results. And also some of the products also have been sent to France, some have been sent to Switzerland for testing. So far the results we've got, the suspicion is somehow high for some of the medications. And the medications that we tend to have high suspicion to be possibly either cause or to be an aggravating factor are medications we are trying to recall from the market. So at the level of the importers, wholesalers, and the retailers, we have already recalled these medications. Now we want to go a step further to do recall at the household level. So this recall, in collaboration with partners, Ministry of Health, MCA, we're hopeful to start the program or the activity on the 5th, that is Wednesday coming, where we go to households and try to see how best to take these products from household level, because as we said, there is high suspicion regarding their safety for use at the moment. So as it is an emergency situation, anything that is strong suspicion, definitely action has to be taken to further prevent harm and thereby preventing more kids from dying. So far, so good. These are some of the steps taken by MCA and its partners regarding medication.
I'm going to ask you to translate it in Mandinka before I try to do that in Wolof. But before we do that, can you just name some of the medication? Because the thing is that people are listening now. Yeah. So even before you go for the recall, those who are listening can immediately just take these things and keep them aside so that they're not going to use them anymore. So if they hear you say these things, it will be very useful for you to tell us which medications are we talking about that we should be careful about now for children.
Yeah, for the 3 medications at the moment we are targeting the paracetamol syrups for the moment, promethazine syrups, and cough syrups. Okay. So these are the 3 categories of medications that we are so much concerned at the moment. Okay. But still others are being investigated. Sure. So in case something else come up, so our scope may be expanded in terms of the
in products. Case also something has been cleared, then maybe we can now reverse that. But that is not. I think also again, and I'm hoping that when you translate, you're going to put all these further questions that I'm asking on it. But I don't want to miss them. That is why I'm asking them. Yeah. The other thing is that these children come with fever. These children come with vomiting. Diarrhea and cough, and I'm sure the doctors will be trained on what else to give.
Yes.
but maybe we can reassure our viewers that something is being done about alternatives that we can give. So the syrups are implicated, but are the tablets also implicated? If we were to reconstitute a tablet locally and give it to a child, will that work for fever? For instance, paracetamol for fever. I just want to know whether there are alternatives that we are looking at for these children.
Yeah, actually there are alternatives. What has been recommended for the moment, we try to give paracetamol tablet, but these tablets, the healthcare workers will train the parents how to cut these tablets, and also, if possible, to have pediatric tablets, because long time we are having pediatric paracetamol tablets in this country. 100 milligrams that you could easily break even to get 50, or you get your 150, 1.5. So I think we can try to go that way for the time being. And for the cough syrups,
what about the rectal paracetamol? So
very good at the moment. Yeah, suppository paracetamol suppository is also other options. So still there are options on the market. Paracetamol suppositories are there. In fact, I personally, that's have been my choice for so long for my kids, especially if they have high fever, they're vomiting. I always try to use the suppository for the kids for a long time. Yeah, quicker. So forth.
Yes, so I will allow you now, if you don't mind, to translate everything we have talked about now in summary in Mandinka. Then I'll try to do that in Wolof. In the meantime, for our viewers, we're going to open the lines because this is very important. That means that we're going to be interrupted along the way while we are talking. And anytime somebody calls, we're going to interrupt because we feel their questions are very important. So we will translate that in Mandinka. In the meantime, we're going to open the lines on 50500505. Boka ñu ubi line 5050. 505. Maybe we can say that in Mandinka. I don't want to give some bombshell in Mandinka. I know what to say, but it's not. It might not sound right. In Mandinka, that lines are open on 5050.
Okay, Dr. Yaka mem for lem cyber telephone line only yella. Remember left commandiro kele sake no. So numbers ninga ka ole repeat.
505005. So please tell us what we have just talked about now in Mandinka.
Kachaw ni wati situngo fonko ngamem fo tuabu kanto wolem dindingolu menkanin kurang so de gave acute kidney injury wole ko kilolu ka problem so to wati situngo no jama ni nata loptano to doctor rol men keje ye memfo jama ni balakandole kana dolning phono, dolning konobayo, dolning.
Mr. Marina, as I said, we will have calls. In a moment, we have calls, so I'm going to just pause you a little bit. Yes, caller. Hello.
Hello. Assalamu alaikum.
Wa alaikum assalam wa rahmatullah.
Alaikum salam.
Yumulle.
Abeje.
Okay. My name is Ibrahim Asanyandi. Ote Oljundum. The mom case been is 3 to 4 years. Who got the case been?
Sigilko.
Wow.
It's very sad. It's very sad. Wow.
Yep. Askan de buñ febaré. Amuñu fenn fu ñoo daw lu dul lopitaan.
Dégala.
Lopitaan yi dama feel ne ñoom tan day war a gestu bu baax garab buy dugga ci réew mi fii nii. Because nit ki yàlla lu mu dogal moom jaam bi mënu ci dara.
Dégala.
waaye day feel ne government bi tamit ak wàllum wér bu yaram bi dañ war a képp ci lay kattan. lu dugga ci réew mi pour faju. ñu test ko seegaati ko ba ñu xam ne bii mun naa is fit to be in the country. ñu bàyyi ko nit ñi yuut ko. ñaareel bi tamit. dem nañ lopitaan. waaye amul benn garab bu ñu am si biir lopitaan bi lu dul ndox buñ ñu dee jox Acute lay ndee dem di jël test. waaye tamit maa ngi gërëm ñooñu noonu because bu ma fa demee ab jaaxle tey moom ubbil bunta yi. ñu testal ma jox ma information yi pour gars yi go ahead with the treatment. pour after mu mun a fay. daf dee toolu situation boo xam ne tamit pharmacie ni si biir Banjul. wala si biir réew mi fii. suba ba ngoon. ñu bari tëj nañ. doo am benn garab biir Banjul lu dul nga dem ba Westfield te Westfield tamit dafa am time boo xam ne. dañoo jaay garab am na time bu ñu dee tëj. te foog naa ne government bi si turi government bi lay waxee still because ñoom lañ yaakaar ñoom ñoo war a teg everything in place ñun si lu ñu foog ok wàllum garab fooy jëndee garab warta nekk problème si biir réew mi fii
dëgg la
te pharmacien tamit booy joxee licence to pharmacien da nga war a seegaati docteur yu fa nekk ak ñuy liggéey foofu bu baax lu ñoo joxee askan bi ndax lu baax la wala lu baaxut la bu nit ki bu mu am xaalis rek pour fay licence nga jox ko licence mu operate because at the end ñu ñaaka xale bu dem ni mun naa nekk président mun naa nekk
docteur mun naa nekk lu nekk dégg mun naa nekk lawyer anything waaw mun naa nekk teacher
anything
waaw
for the Gambia not only me the parent but for the Gambian people
it's a loss and I think loolu moo tax foog naa ne liggéey bu bëri mu ngee dox ci gannaaw boo xam ne wax dëgg yàlla dina difficult ñu wax yëpp fii nii because programme bi benn waxtu rek la so naa la ñaan dégg nañ loo wax nii yëpp dinañ try ñu answer some of it waaye loolu tax may doon wax Mr Marena ci njëlbeen bi ne dinañ am fii agency bi nga xam ne moom la ñoo ooyee MCA Medical Control Agency ñoom ñooy contrôle lii nii yëpp nga xam ne dinañ wax askan bi wan leen jéego yi nga xam ne wax dëgg yàlla ñu ngi koo jël benn nit yi sax yëguñ ne jéego yooyu mu ngee dox waaye jéego yooyu mu ngee dox si gannaaw rideau yi waaye tam beneen tam lu ñu war a xam tam mooy ne garab léegi nii li suspect rek la dañ suspect ne moo ko cause ba léegi óoraguñ ne sax moo ko cause te garab yi nga xam ne moom moo am si dëkk bi yëpp lu ci ëppa yëpp dafa dañ ko dee seet mu ñëw dugga si waaye nag ba tey óoraguñ ñu ban garab la foog naa ne ñu xamee ko noonu waaye man dinaa leen promise ne dinaa toppa jéego yi nii ñu am fii nii MCA ñu gën a waxtaanee mbiri garab yi dëgg la am na yu bëri yoo xam ne mu ngee dox yoo xam ne wax dëgg yàlla war nañ a try ñu change ko waaye tam am na yu bëri yoo xam ne mu ngee dox boo xam ne xëj na askan bi yëguñ ko moo tax yenn seen xol du dee neex si la nay xew so ñu ngi laa gërëm bu baax a baax si li nga xam ne indi nga ko fii nii ci biir waxtaan bi dinañ jéem a answer some of it waaye man dinaa la promise ne dinañ fi indi MCA ñu toog full waxtu wala ñaari programme sax ñu waxtaanee lii pour askan bi understand lan mooy xew jërëjëf yes Mr. Marena maybe we'll just continue with what you were talking about the medications that are implicated and
so konka men fodam borol ni borol mu sainte bori sabalem paracetamol syrup e ka fodo e promethazine syrup wo mu pro fono leti then dol cough syrup wo mu pro toto lati so paracetamol syrup wo mu pro balakandol because jama ni dindingolu ni nata lopitano to e ka balakandole soto e ka toto soto dol kono ke bay dol ka fono so ni bori sabol sainte nga menje nge suspect le ko maybe they could be part of the problem. And either is no cost the o fana is kuoning jamban no yata nung cost do be duma. So science lafta mena promol sinim borisa bolong ye hakilol tuto suolu kono e kanem iming moma asoto yela bun kono ye landi karala. Because Minister of Health aning nadoku lega me MCA anin na partner kotengolu ning arabanala nyanta duko dokela kata molla suolu kono kanim borol gibe keta fo nyato because ngaje konim borol sainteng imanko ipromoye ta katu momal ada manko ma 100% bari suspicion bigele ko nim borol fananda sitra no problem o konale.
So am I right to say, maybe you can translate this directly into Mandinka if you agree with me, but am I right to say, if I were to advise everybody, any medications you've received before, for anything, before this thing came up, stop it, don't ever take it. If you want any medication now, go to because now the pharmacists know that they should not give promethazine syrup, they shouldn't give paracetamol, they shouldn't give the cough syrups. The pharmacy knows that now. Yeah. So if we advise our listeners that, look, anything you had in the house before, just keep it now. Don't use it.
Yeah, actually, that
okay, before you go to that, there's another caller. I'll allow you to go to that if you agree with me. Yes, caller. Yes, ñu la dégga mbe la moy
suto be ñaaral be kay rekono
Bekayra
Kind of
Doro.
wrong.
Very wrong.
Allah program o interest so much. Hello?
Hello, Bemoy.
Man seen programme bi dafa interest torop.
Wow.
Waaw comme noo leen ko waxee paracetamol syrup boo leen nekk di wax ak yeneen garab yi mooy ban garab ak ban garab because paracetamol syrup laa dégg ak
Paracetamol, promethazine ak cough syrup. Promethazine pour wëccu la dañ ko day jox xale yi pour wëccu. Cough syrup mooy garab yi nga xam ne dañ ko day jox xale yi pour ñu bàyyi sexat xale yuy sexat mooy ne garab yooyu noonu yëpp léegi nii lu ñu Mr Marina wax léegi nii ci mandinka ak ci angale mooy ne garab yooyu noonu nañ ko bàyyi léegi buñ ko use ñoom ci seen boppa nag dinañ dem si kër yi di génnee garab yooyu noonu ci kër yi waaye léegi képp ku ñu dégg daal na xam ne waratuñu jox benn xale garab yi nii parce que garab yi nii benn ñu ngi waral feebar bi wala benn ñu ngi gën a garaawal feebar bi mun naa amit tamit amuñ ci loxo waaye léegi xamaguñ ñu ngi koo cek so ñu ngi ñaan nit yi daal nañ bàyyi garab yooyu noonu pour ñu bañ a am xale yi di dee di continuer di dee ok
kon loolu baax na trop kon seen programme dafa over interest
jërëjëf
jërëjëf ci seen programme bi kon
Mr. Marina, I'll have to go to Dr. Jain to ask about infections. But for now, would that be a sensible advice? If not, you can say no, and then we can.
Actually, it's a very useful suggestion, but already our strategy is to concentrate on these three because we look at the economic factors also. If you put all medication that the parents buy, because I was talking to one of the colleagues who is a parent who was even asking, when you take from people, are you going to replace it? So you see.
Yeah, but I'm thinking to you from something that may be poisonous to you.
Yeah.
So I don't know.
Yeah, so that's why
anyway,
but the moment for the recall, the strategy is the three for now.
They should not use.
As I said, the scope may change
Yes.
later on, but for now.
Because my worry was that if you say paracetamol, you see from the speaker that was speaking, if you say promethazine, they may not even know what promethazine is. Cough syrup, they may not know what it is. So I was just thinking from safety point of view that we can say just drop all medication. But you are right.
So what the strategy is, when the volunteers go to the homes, they will ask them to bring out all the medication they have for children.
Okay.
Then from there, they will figure these are the ones we are not advising you to give to your children.
Fantastic. That sounds very good. That sounds very good.
Yeah.
So we have talked about the medications, Dr. Jain, and you did tell us that there are lots of things that are suspected. Apart from the medications, infectious causes could be implicated because the children come with fever, and whenever a child comes with fever, we think that there might be an infection that is implicated. Is that something we are working on? Is there any evidence coming out that there could be an infective cause that may be aggravated by the medications that we are taking? What is the situation in that?
So so acute kidney injury is one of the diseases that will often is associated with infections. And in this situation, what we found was that there was a high they found a lot of cases that had E. coli. And the strain of E. coli is the strain of E. coli that we know causes kidney injury.
Yes, with a toxin.
There's a toxin, yeah. So, and the enterotoxic E. coli is the one that that causes acute kidney injury. The disease itself is not what caused the injury, but because the body has an immune reaction to the presence of the organism in the body, then it causes injury to the kidney. In a simpler way, that's what happens. But if you look at that, that's not unusual. I mean, at this time of the year, in the rainy season, kids have diarrhea, and often it's from E. coli. I mean, one of the strains of E. coli that will cause diarrhea, and a percentage of them will have some form of kidney injury. But the level of death, the level of kidney injury that kids have, doesn't commensurate to that.
To that, yes.
In my practice, and not only in my practice, in where it has happened before, even in Germany when it happened there, the death rate was 40%, which is probably was the highest. That one was because they had some incident when people were eating a lot of roots from some gardens that the food was contaminated, the food chain was contaminated. And often they have it in egg and so on. But even at that, when they have it, and it's not that 10% that is there, that will have the AKI from what you call HUS, hemolytic uremic syndrome, the death rate is not more than 40%. But in these kids, it's 80%.
Almost 80%, isn't it?
More than 80%.
More than 80%, yes. A lot of them have died.
85%.
85%.
Yes.
85% death rate.
Yes.
So out of every 10 who have it, 8 to 9 would die.
Die.
So only 1 would be saved out of those things. So this is really a very high death rate.
Tragic.
And it's very tragic. It's very tragic. And really, we are focusing on the acute kidney injury. But we also understand that these children also come with multi-organ. I mean, even the liver. Even the liver fails. So this is really a serious thing.
I didn't want to make it very, very academic, but I've seen things that I've never seen before.
Yes.
I've seen AKIs in the center trained in.
Yes. We will have to interrupt you. Sorry, there's another caller on the line. Hello.
Hello.
Yes, sir.
Na ngeen def.
Jaama rek sant Yàlla.
Mr. Ya ñu ngi rafetlu programme bi man la Malick Touré maa ngi ko Neema.
Jërëjëf Mr. Touré jërëjëf si call bi.
Waa affaire wérgu yaram moom man for the past 2 years maa ngi come across with this moo tax any programme bu ma dégg ci lii dama dee taaxirlu dégg yàlla di déglu ni nga ko waxee because ki feebar moom xëy na laaluñ suma feebar bi waaye feebar bi moom ñëpp la laal.
ñëpp la moo laal waaw.
waaw xëy na boo dugg ci biir fekkee beneen. boobu itamit nga wax ci li nga xam ne mooy sa xalaat ci programme bi.
dégg la dégg la.
waaw di leen jërëjëf rek di leen ñaanal yàlla yal nañu yàlla may wér.
ak wérle jërëjëf ñu ngi laa gërëm.
dëgg la
ñu ngi laa gërëm jërëjëf si call bi. Yes. Jërëjëf. Mu ngi mel ni léegi nii we have just about 4 minutes to go. So we have to really summarize things. But just, yes, you were saying you've seen things that you've never seen before. And
a child, as I also already mentioned, they have very high level of creatinine. They have high liver function test.
Liver function test is
in the air.
Yeah.
Yes, they have.
And that is why also when we treat them, you know, I've been seeing Dr. Jallo and working with Dr. Jallo to put these tubes in them. And even when we give them the peritoneal dialysis, they don't survive. They don't respond. They still don't make any urine.
Even the one that was 7-year-old that we had dialyzed.
Yes.
In my practice, I've seen that if you dialyze somebody with AKI, suddenly it sprang up.
Oh yes, they'll get better.
But this child never even opened his eyes.
Because there are other organs that are affected. So really, I think the message that we want to give here, if you guys agree with me, is that this is really a serious situation and the whole country should know about it. And the whole country should also know that there's a lot going on in the background. It is not that the government or the ministry is just keeping quiet and waiting for things to happen. Things have been sent to Germany, things have been sent to Senegal, things have been sent to Ghana, things have been sent to Switzerland. So there are lots of things that are going. We have only 2 minutes. So what I'll do is I'll go around the panel again and just get your last words. What is the most important thing that you want to tell to the society from this program today? So your last words in English and if possible in Mandinka.
Yeah. So what I want to tell the viewers is that we have up to date 78 cases. Wow. And then 66 of them have died.
Oh my God.
And then the other thing that is very important is for people to quickly go to health facilities or hospitals when their kids are showing these symptoms that have been mentioned here.
I don't understand a parent waiting for 2 days. Yeah. My child is not passing urine before I end up in the hospital.
1 week.
If you look if you look at the history, some before they report to facilities because their kids are not passing urine, it goes up to 6 days.
Ouch. Yeah.
But we've also realized from data that we have, those parents, because out of all this data, we have 2 or 3 that survive.
Yes.
And most of them report to facilities quickly,
very early
as possible.
Yes.
So let the people not use these medications that have been incriminated, and let us go quickly to the health facilities. So coming forward, ñing kurang o tonyalam abe nyamin alhamdulillah bare ay mol mi muta sañ atata fo mo taworo wala ni sey andu mim panta kono wala mi tata fo mo taworo ani woro so e bajela ko mo jamala fata bar min ko mata wala mi te ko nga taman serol min fo wala balakando fono anin kono bayo anin toto naliaji don altarali dindingol samba lopitano to e sadio ko docteur on ning no sol sejono because nga kala mutale ko dindingol miyalon ko ye samba lopitano to juna.
Yes, do that. We've been giving another extra minute, but that's it. So let's summarize it there.
So
yes, you know, thank you very much, Mr. Mane, for being here. Lu mu wax rek léegi nii mooy ne juróom-ñaar fukk ak juróom-ñetti xale la dal juróom-benn fukk ak juróom-benn yëpp gaañu nañ ñi nga xam ne ñoom ñoo ci mucca ñu ci bëri dañ teel a jóg nga am nag sa xale toog ay fan munta seben nga door a dem lopitaan loolu noonu foog naa ne war nañ koo moytu su xale bi commencé am ay problème rek ñu gaaw gis ko. I'll give you 30 seconds, sir, because we really news is coming up and there's nothing we can do.
What I want to say, there is going to be a very important household medicine recall activity starting on Wednesday, and everyone should give all the necessary support for the program to be successful.
In Mandinka.
Ning araba lungamen kana Minister of Health MC ani partner ko tong nyanta ka borolu tab molu bulu suolu kono borol me alon ko njikita isi dabenim kurang la problema ko so lafta men na molu be support dile men ni so the program on is successful nga borol.
Thank you, Mr. Marina. We'll have you here again. Mbokk yi lu mu wax rek mooy ne ministre bi àllarba bi nit nañ commencé di jël garab yi si nit yi su na leen nit yi yëpp support su ñëwee nañ leen dimbale ñu wan leen garab yi ñu am yëpp ñu mun ñoo génneel yi nga xam ne mun nañoo indil xale yi problème. Another 30 seconds for you, sir, before we close.
From our end, we just want to buttress the fact that people have to respond to hospital early, do whatever they need to do, and sometimes the delay is from the family. They don't decide what you want to do. You want to do the test? No, we are not going to do this. We don't want the procedure. We have people who refuse for us to pass the peritoneal dialysis catheter.
Okay, time is up. Yes. Thank you very much to all my guests. Lu mu wax rek mooy lu Mr. Mane wax mooy ne nañ teel a jóg mbokk yi lii rek lañ am nag tey mënuñoo dem any further waaye dinañ am si gan yi ñeneen ñoo xam ne dinañ gën a waxtaanee lii ñuy gërëm suñ gan yëpp fii ba beneen yoon. Ladies and gentlemen, this is all we have. Thank you to all my guests today. Until next time, bye-bye.